a complex chronic pain that usually is accompanied by tissue injury. So common qualities include burning or coldness, pins and needles sensation, and tingling and numbness. So causes include like back and leg hip problems, diabetes, and shingles. So patients that have neuropathic pain are some of the patients that are prescribed Prialt. Back pain. So what back pain is, it's a felt in the back that usually originates from the muscles, nerves, bones, joints, or other structures in the spine. So common qualities of back pain include radiating down the legs, inflammation on the back, weight loss, grinding sensations, burning, and elevated body temperatures. So some causes of back pain include strained muscles, strained ligaments, lifting something improperly, lifting something that is too heavy, and the result of an abrupt and awkward movement, or in muscle spasms. So that's what back pain is caused from. And that's another type of pain that Prialt is used for. So mixed pain. Mixed pain is a combination of nonsusceptive and neuropathic pain. So nonsusceptive pain is caused by damage to body tissues, and it's usually described as a sharp, aching, or throbbing pain. So this type of pain is usually time limited, meaning when the tissue is damaged, it heals, and the pain typically resolves. So common qualities include burning, coldness, and tingling. And causes include chronic low back pain, cancer pain, and complex regional pain syndrome. So a lot of patients that are prescribed Prialt have complex regional pain syndrome. And what complex regional pain syndrome is when you don't have feeling in your hands or your ankles and you can't feel. So you're putting so much pressure on it every day, and it builds up without you knowing because you don't have feeling. So it's making the muscles in your hands or your ankles really weak, causing damage to it. So the last pain is cancer-related pain. And cancer-related pain is the way your body responds to tumor growth or the injury and damage that the cancer is causing. So common qualities of cancer pain include severe ache across the back of hips, burning, numbness, and weakness in your lower extremities. So causes of cancer-related pain include tumor pressing on bones, nerves, or their organs in your body. Also, cancer treatments like chemotherapy and radiotherapy are causes of cancer pain. So then you have your basics of Prialt. So some possible side effects of Prialt. There's a lot of both serious and less serious effects of Prialt. Obviously, it's a drug that has many complications because not a lot of patients can be prescribed Prialt. So some of your more serious effects are problems with memory, double vision or other vision problems, feeling paranoid, hostile, disoriented, or confused, hallucinations, feeling like you might pass out, new or worsening muscle pains, cramps, soreness, weaknesses, dark urine, unusual bleeding, fevers, headaches, neck stiffness, depressed moods, strange sensations in your mouth, and feeling less alert. Some of your less serious effects are some minor headaches, dizziness, sleep problems, stomach pains, drowsiness or weakness, spinning sensations, diarrhea, constipation, or loss of balance or coordination. But as you can see, there's more serious effects versus less serious effects. So if you are prescribed Prialt, then you were absolutely unresponsive to any other pain treatment that there is. Because I think they use it as a last resort rather than you just prescribing it because of all the effects. So some precautions when taking Prialt, there's a lot of psychiatric symptoms and neurological impairment that may occur during the treatment of Prialt. You should not receive Prialt if you have a history of psychiatric illnesses or psychosis. So if you have a mental illness, Prialt's really not the drug that you should be on because it does cause a lot of neurological impairment. So you should not use Prialt if you are allergic to ziconotide or if you have an uncontrolled bleeding or blood clotting disorder. So some statistics of Prialt. So for millions of people with intraceptable pain, Prialt offers 1,000 times the analgesic power of opiates, but without the addiction and waning potency, so which means decreasing effectiveness or strength. So according to the FDA, the following has been recorded. So they've done research, and because it's a relatively new drug, there hasn't been a lot of patients that have been prescribed Prialt. So there's only a minor amount of patients that they could have done research on. So out of the research, some reports of any side effects developing while on Prialt that have been reported are about 684 patients. So some percentages of Prialt where for fatigue has been a problem is about 6% of the patients, and that's statistics of what has been reported to the FDA. So this is some pictures of me at my mentor site. This is the patient room. Toby, which is Dr. Garcia's assistant, showing me how to work the MRI machine, the ultrasound machines, and the chalkboard in the patient room. So these are more pictures, and right there is actually the stomach pump that is put in the outer abdomen or back part of your body. So Dr. Garcia would actually, when prescribing Prialt, would do a procedure and put in implant the pump inside of you. So it would be a whole procedure, and Prialt would be put in there, and every day it would be slowly given to you. So in micrograms, because it's such a heavy drug, every day you would get like 0.1 micrograms or whatever you are prescribed. But the dosage prescribed is very low. So I have my final product. And the final product is a summary of the indications, pharmacokinetics, which means what the body does to the drug, and pharmacodynamics, which is what the drug does to your body. My project involves two parts, the PowerPoint presentation about the drug and the tangible item. So the tangible item is a flip chart in the shape of a stomach pump, and the pump will be divided into sections, which provides details about the metabolism of Prialt and indications for its use. So my final product is this. So it's in the shape of a stomach pump, and you lift it up, and it's basically like it's reiterating what my PowerPoint says, like the symptoms, the causes, the precautions you should take about the drug, and then just some extra pictures. And this is the cone snail, which is where the liquid comes from, which is where Prialt comes from. So that's my final product. And my objective with this project is to inform and educate regarding the new drug Prialt and its tremendous potential for clinical benefit in the field of pain management. So Prialt has not yet been really informed to a lot of people. It's still relatively new. So I think that Prialt will continue to the word will get spread around about it, and only some pain management doctors have started using it because it is so new. So I chose this project because this drug is a novel agent with great potential for pain reduction. So I think it really does have effect. Everyone that I get to go to Dr. Garcia's for 2 to 3 hours a week, and a lot of the patients we do see are prescribed Prialt, and they, when they do their checkups, we can see that they have gotten better, and it really does work so much better. But then again, we do see that there are many side effects to Prialt. So I would like to thank the following people who helped me with this project and contributed their knowledge and their guidance and their time. I would like to thank Dr. Ed Garcia, which is my mentor, Ms. Click, and my dad. So throughout my presentation, I have kept a Weebly and an online, which is my online portfolio of what, like my ISM assignments, my final presentation, my midterm presentation. Every assignment I've done, a resume just to keep on file. And I've also kept a binder. So my binder has my journal entry. So after every week we go there. So after every week I will do a journal entry saying what we did there. So I printed out all my journal entries. I have my activity logs, which keep track of my hours, my documentation, some of my artifacts, my article review assignments, some video critiques, my progress meetings done by my teacher and my mentor, and a copy of my midterm presentation, my final presentation, and just my different evaluations. So my binder keeps track of that, and so does my weekly. So I'll show you my weekly. So this is my weekly page. So that's Dr. Eduardo Garcia. And it just, like, it has my different tabs. And this is a copy of my resume. And it just kept track of everything I have done this year. That way it's organized and easy and accessible. And that was my weekly page. So, and these are all my different sources I use to get the information on Prialt. So that is my presentation.